look at how to perform a static postural assessment. Initially, we want to look anteriorly at the person as they stand. It may help to have them stand against a wall with lines on it. Something even simple like a brick or a cinder block wall will help you assess the levels at the shoulder and the hip. As you can see here, we're again assessing all of the levels of the kinetic chain. The foot and ankle, we hope to make sure that they're straight and parallel. We don't have flattened feet or feet that are externally rotated or toes pointed out. The knees should be in line with the toes as indicated by the straight lines here. They shouldn't be adducted or abducted, either bowed out or bowed in. The lumbopelvic hip complex, we want to make sure that the anterior superior iliac spines, the ASIS, or those hip bones right on the very front, we want to make sure that they're level across the transverse plane. Next, we assess the shoulders. Make sure that they're level and that they're not elevated or rounded. Finally, the head. We want to make sure that the head, while in a static posture, is in a neutral position and not tilted or rotated. We next go to a lateral view. And again, we're going to make the same assessments at the same levels. The foot and ankle need to be in a neutral position, and the leg has to be vertical at a right angle to the foot, as seen here. The knee should be in a neutral position, not flexed or hyperextended. The lumbopelvic hip complex. We want to make sure that the pelvis is in a neutral position and not anteriorly or posteriorly rotated. If we have an anterior rotation, what we'll see some lumbar extension. If it's posteriorly rotated, we will see excessive lumbar flexion. The shoulders, from the side, we want to make sure that they do not have a curve and that they're not rounded. We'll talk about this in an upcoming slide. Again, the head, we want to make sure it's in a nice, straight, level position and not into extension. We can use the ears here as a marker to make sure that they are in line with the shoulders, hips, knees, and ankles. Finally, from the posterior, the foot and ankle should be straight and parallel and not overly pronated. Again, those straight lines extending down from the knees. The knees should be neutral, not adducted or abducted. The lumbopelvic hip complex, we now look at what's called the PSIS, the posterior superior iliac spine, or those hip bones placed just above our butt cheeks. We want to make sure that they are level in the transverse plane. Shoulders, we're going to make sure that they're level and not elevated. We're also going to look for shoulder protraction. And by looking for protracted shoulders, what we're going to do is look at the medial borders of the scapula and make sure that they're parallel and about 3 to 4 inches apart, indicated by these small lines here. Again, the head should be in a neutral position and not tilted or rotated in either direction.